One of the most common questions that I get asked as a gynecologist by pregnant couple is about childbirth education. Doctor, I hear a lot about people taking childbirth education classes, people giving courses on how to deal with your labor and birthing. Is it really important? Should we take childbirth education? If so, why? Hello everyone, this is Dr. Santoshi Nandigam. I'm a consultant obstetrician and gynecologist. Welcome to my YouTube channel. Now, here are the 5 reasons why I think as a gynecologist that it is quintessential to attend a good childbirth education course. Number 1, we tend to do well in anything if we are prepared for it. So it can be a simple exam. Well, it might be a little easy to clear your exams even if you're unprepared, but when you tag a component of pain to it, I think that's when you give up. So childbirth education prepares you to, make up your mind about the various occurrences in the whole process of labor. Number 2, pain is a very, very, very stimulating phenomenon. So your body's response to pain can be many things. In fact, when a woman is in labor, unfortunately, it is painful. Labor is not easy. Labor is painful. So pain can trigger so many unwanted physiological reactions from your brain. And one of them is stopping the progress of labor. So what happens is when you're in pain, you tend to develop or build up stress in your body. When you build up stress, there are certain hormones in your body which increase. So when you have the stress hormones on the high, it actually decreases the birthing hormones and inhibits the process of labor. So when you take the component of pain out, and which is exactly what you learn in childbirth education through the classes or courses, the way you respond to labor, the way your body progresses to labor is really, really, really beautiful. So your body gets into a natural high through these beautiful hormones called as endorphins. So you will only know how to activate them if you know how to deal with the pain in your labor. Number 3, labor can be many things. For some women, it can be decreased fetal movement. For some women, it can be an upper abdomen pain. For some women, it can be a lower abdomen pain. Some can experience a low backache and they can still be in full-blown labor. Some women experience mucoid discharge. For the first-time mothers, it's actually very confusing as to what is going to be the sign and symptom of labor. Not every woman will have frank uterine contractions. Not every woman will be able to differentiate between a false labor and a true labor. Unless you get yourself educated from someone who has expertise in this field, you might not be able to differentiate what is true and what is false, what is in the books and what happens practically. Now, you can ask me, doctor, there's so much information available on the internet. Why do I have to attend a childbirth education course separately when all this information is available for free on the internet? Well, internet says a million things. Internet says with the first surge of a contraction, you just have to run to a hospital. But over years, many studies have proven that a lower risk mother without any comorbidities, an average size baby, can stay at home as long as the pain is manageable, provided there are no other warning signs or other warning complaints or symptoms. So only if you attend childbirth education courses from a really good birth educator, you will be able to know what is normal and what is abnormal, until when you can stay at home or when you have to walk into a hospital. So that's how it is really important to get a childbirth education course for couples. Number 4, childbirth education helps develop realistic expectations. Now, many people come and ask me, doctor, why can't you just guarantee me a normal delivery? Isn't it a natural process? Shouldn't it happen naturally? Why am I seeing a cesarean section? Why are we seeing the increased cesarean section rates? Well, nobody can guarantee whether you're going to have a normal delivery or a cesarean section. Yes, labor is about unexpected occurrences. You can prepare to labor to a certain extent, but childbirth education also puts down certain conditions or certain situations which you can probably encounter in your labor. So it helps to set certain realistic expectations of how the course of labor is going to be. It also helps you to develop or to be apprised about what are the complications that you can encounter in labor and how to deal with those complications. Number 5, it paves the way to develop a good, positive birthing experience. So I am someone who completely believes in the journey is better, or it has to be as important as the destination as well. So I believe in the concept of birthing experience, and I would want all my mothers to have a wonderful birthing experience. So I do come across women who are completely terrified of the whole concept of labor. They're terrified of the birth. They're terrified of the blood. They're terrified of having a cut or an episiotomy. They're terrified of having a cesarean section. Once they are done with the delivery, they completely occupied or completely overwhelmed with whatever happened, and they really don't want to go through another pregnancy or another delivery. This is the first statement that they give. Oh my God, I am not going to have another baby. So why should you actually say that? I mean, what happened in your birth that contributed to getting this really dominant statement out? I mean, that's a wonderful process, right? You never stop loving your child. At the end of the day, having that child in your hand itself is a wonderful experience, but the whole process is very overwhelming to mothers. So I believe in giving the mothers a good birthing experience, and childbirth education actually paves ways for developing a good birthing experience. And there is a lot about birth trauma that is completely unspoken about. So if you want to prevent birth trauma, if you want to, not be inhibited with the whole concept or thoughts of labor, I think you should attend childbirth education courses. If you like my videos and for more empowering and interesting content related to pregnancy and childbirth, do subscribe to my YouTube channel. Thank you so much.